Welcome to the classroom. I'm Dr. Roshan Ramnarayan, and welcome to a lecture series with you, me, my trusty whiteboard here, where we go through matters of the body, mind, heart, and spirit. And I try to make it as easy and relatable as possible in a way that could help bring understanding to otherwise complex matters. And so I want to begin today's class by painting you a picture. Let's go back 10 years. A young Dr. Roshan Ramnarayan, working in the hospital, head full of hair, heart full of dreams, still bright-eyed and bushy-tailed. And I came back from abroad to begin working here in my homeland, looking after my people, after spending a lot of time looking after everyone else's people. And one of the things that I noticed, one of the patterns that I saw whilst working in the general hospital here, was there were a couple of illnesses that people kept coming in over and over for. Stroke, bleeding behind the eyes, heart attack, kidney failure, foot ulcers, all of these things. And what I realized was the one common thread, the one common disease process that all these patients were coming in with was, you want to make a guess? It was the dreaded diabetes. Doc, I have sugar, as they say colloquially. And reflecting back on that time as a young physician, I have no choice. I have to talk about diabetes with you guys to be able to bring understanding to the people as to exactly what diabetes is. Whenever I meet a new diabetic in my office, I ask them the question. The first question I always ask them is this: hey, just out of curiosity, how did you get diabetes? How did you come about this disease? And the answer usually shocks me. Most of the time people say, well, my mom had it or my dad had it, so I got it. I think maybe in the many years of practice that I've had, a handful of people would have said, well, I ate a lot of flour, I ate a lot of sugar, I didn't do the right things, and as a result of that I got diabetes. Most of the time people think, well, it runs in my family, so I'm going to get it. But we have to remember, guys, diabetes is called a lifestyle disease. And I'm here to tell you today that we can manage diabetes by simply making some lifestyle changes. Now, it might seem frustrating and daunting and incredibly difficult to change these habits that we would have had over the many years that created diabetes in the first place. But guys, I'm here to explain to you what diabetes is. And it is my hope that by educating everyone, by helping them to understand the disease process that's going on within their own bodies or within their loved ones, they can now understand why they're doing what they're doing. So for instance, if I were to just say to a diabetic, stop the sugar, stop the flour, go and exercise. Obviously we know that is the right thing to do, but a lot of times we don't do it because we're not sure why. We're not invested in it. Of course it's our health, but there's not much understanding. And so my hope is that by the end of today's lecture, we will all understand why stop the flour, stop the sugar, go and exercise. And by having that understanding, it will give us more motivation to actually do it. So let's ask the first question. How does one get diabetes? So diabetes doesn't happen overnight. It takes a long time. And diabetes is defined by insulin resistance. Now, before I can talk about what insulin resistance is, I have to let you guys know exactly what insulin does. And so what insulin does is, as we eat food, once we have carbohydrates and we put it in our mouth, it goes down our esophagus, into our stomach, and it goes into our intestines. And it's that carbohydrates broken down into sugars, and it's absorbed from our intestines and it goes into our bloodstream. So that sugar now is in our bloodstream. Think of the bloodstream like a highway, for instance. Insulin is the hormone that pushes that sugar in our blood. It pushes that sugar into our cells to be used as energy. So essentially, insulin directs sugar from blood vessels into cells. Now this, put a marker here, put a pin on this, because this is important. This is important. So that's what insulin does. So we have a bowl of ice cream, for instance, and our blood sugar goes up to 200. Our body releases insulin, and that insulin now pushes that high blood sugar into our cells, and our blood sugar comes down. And our cells use it as a form of fuel. So that is how insulin works. That's how things are supposed to work. So adding on now the word resistance. What does resistance mean? Let me explain. So let's say, for instance, I love diagrams and I love graphs. So, because again, a picture and a diagram speaks 1,000 words. So let's say, for instance, this is a graph here. This is blood sugar, and this here is time. Now this is an important graph. Stay with me, guys. Stay with me. So, let's say, for instance, at 7 a.m., Mr. John Doe has to have breakfast before he goes to work. And that breakfast is, what do we eat typically? Doubles. We'll go at Doubles Man and have 2 doubles with slight pepper. That will spike our blood sugar. Let's say our blood sugar, our resting blood sugar is 80, for instance. Having that doubles in a few minutes will spike our blood sugar up, right? And so 2 doubles with slight, locked and loaded, and we're on our way to work. We get to the office now, and our good friend from across the department says, "Hey, I brought some muffins. Have one." Of course, not a problem at all. Now, remember, our blood sugar spikes, we release insulin. So now our blood sugar goes down, it goes back down. Now, usually when it spikes so high, our body overreacts and it drops our sugar below what's normal. That's where the sugar crash comes from. And so again, like around 10 a.m. now, the muffin man comes, right? We have that lovely muffin and it spikes our sugar right back up. Yeah? And then now, we release a set of insulin and it crashes below what's normal. But then, what happens after 10 o'clock? We have lunch at 12 noon. And what's for lunch? We go to the food court, buy a roti, have some macaroni pie, whatever the case may be. And of course, we must have a tall soft drink to go with it, perhaps. So at lunchtime now, we have a big spike again. And insulin comes down, insulin is released, our blood sugar comes down. And then now, let's say it's 4 p.m. now. Now, we're leaving the office. If there was muffins left from the morning, might as well take one for the road. Or, you know what, as I'm walking down to my car, there's a little convenience store, let me pick up some biscuits for the road and a bottle of juice, for instance. Because for the road. What happens there? Our sugar spikes back up again. And then insulin is released and it goes back down. And then we reach home now, and let's say, for instance, it's 7 p.m. And what happens at 7 to 8 p.m.? We have dinner, right? And what's dinner? Maybe a cup of Milo and some cricks, bread and cheese, something light, something small. But make no mistakes, it spiked the sugar again. And then we have to release insulin, and now we get a sugar crash, and then it sort of normalizes overnight as we're no longer eating. This is chaos, guys. As you can imagine, having to our body going through the day between these wild swings of blood sugar can't be good for us. Our blood sugar, we live between spikes and dips and crashes. Because again, the muffin man comes in just in time as our sugar sort of crashes just to rescue us. And then again, as our sugar crashes, lunch, whew, and that's literally how we go all day. This is not healthy. This was not how we were meant to live. And so, this is how the blood sugar looks, right? And this here, this is a spike in insulin. As with the spike in blood sugar, we release a lot of insulin, right? In response to the high blood sugar. So we have to spike insulin here. You have to spike insulin here. You have to spike insulin here. And we have to spike insulin here. So essentially, we have a lot of insulin bubbling in our blood. And we sort of become accustomed to it. So think back to if ourselves or we know someone who had their first alcoholic drink, the first beer for instance. That first beer would be enough to get us buzzed. But then eventually, if we keep doing it regularly enough, then we have to get 2 beers to get the same buzz. And then eventually 3 beers to get the same buzz. What does that mean? We are becoming tolerant to the effect of alcohol. Congratulations, guys. The same thing happens here. As we have constantly high levels of insulin, in response to that constantly level high blood sugar, we now become tolerant to the action of insulin. In other words, we have become insulin resistant. And so therefore, the same way that 1 beer would have gotten us buzzed, now we have to double the amount of alcohol to get the same buzz. The same way, over time, over the course of many months and years, instead of this, we'll have to produce that much more. And then we'll have to produce that much more. And so we have to produce more and more insulin to have the same exact effect. We have become insulin resistant. And remember, it doesn't just jump like this. It's a slow, gradual progression. That's why, for instance, you hear the term pre-diabetic or insulin resistant, because one of the metrics that we use to gauge how our blood sugar has been is called a blood test called the HbA1c. Every single diabetic should know what their HbA1c is. The value changes over time, but around 6, give or take 1, is what's acceptable. For me, because I talk all day about sugar and flour and dietary changes and exercise, and my patients know, I hope and I ask them to keep their HbA1c be around 5-ish. A little bit lower than what's typically accepted, because I hold them to, a higher standard in that regard, because they know. And so, an HbA1c gives a 3-month window on blood sugar control. Why 3 months, you ask? Because Hb is hemoglobin, that's the blood. And what happens is, this is pretty cool, what it tests for is that red blood cells live 3 months. And so what this test does is that as those red blood cells going through our blood and they're exposed to high blood sugar, they become coated in a sort of layer of sugar, so to speak. So this test looks for how much sugar is on that red blood cell. And so that's why it gives you a 3-month window. So I used to have some old patients, for instance, long ago, before this test was around, that some older guys, and what they would do is, they would confess to me eventually that when they know they're coming to see me, they would fast for 2 weeks and behave themselves for 2 or 3 weeks before. So when they come to get their sugar checked, they're A-okay. But there's no cheating with this blood test. And so this is one of the gold standards, one of the best blood tests you can do to assess where your levels of insulin resistance and where you stand on that diabetic spectrum. And so as you're approaching that cutoff value of 6, using that roughly because the value changes ever so slightly, you become now pre-diabetic. And then anything over that value, you're called diabetic in that regard. So this is important to know. And so now my hope is that we understand exactly how we become diabetic. We understand what insulin does. We understand that through constant exposure to sugar all day, we release insulin in response to that high blood sugar, and then we become tolerant to the effect of insulin over time. And we have to produce more insulin, aka insulin resistance. And again, make no mistake, guys, there is a ceiling to how much insulin we can produce. Because our pancreas, which produces insulin, can only do so much. So as a result of that, there will come a point where we can't produce any more insulin. And because we have gotten tolerant to the effect of insulin to a point, then what happens now is we have now unregulated blood sugar. So that blood sugar now, rather than going back down, we can't produce any more insulin. That blood sugar just goes up there and it just stays. There is no coming back down. And that's a problem. That is a problem. And so a lot of the diabetic medications, for instance, they're designed to help the pancreas to produce more insulin, or metformin in particular, they help to sensitize your body to the effects of insulin, reverse some of the insulin resistance. So this is how we become diabetic, guys. That's why they call it a lifestyle disease, because we're living life a certain way. So for instance, anyone who intermittent fasts, for instance, where they don't have any protein, carbs, or fats for 16 hours at a time at least, check out my intermittent fasting video, we don't have these spikes in blood sugar. And as a result, we wouldn't have these spikes in blood insulin. And so that way, as the blood insulin level drops, we become more and more sensitive to it. Again, think of someone who has alcohol. If they were having one beer every single day, they would get tolerant to it. But let's say they took a 3-month break from alcohol. When they go back to that one beer, they'll get a buzz because they're no longer tolerant to it. So think of it like that. So this answers the question, how? Now, let's move on now to exactly what is diabetes. Obviously, it's an endocrine disorder, it's a hormonal disease, right? But where does diabetes have its major effects? Where is the action of diabetes? And here, this is what answers that question. Because if insulin is no longer active, then it's no longer able to direct blood sugar into cells. So essentially, that sugar just sits in the blood vessel, which our blood vessels were never equipped to deal with. Our blood sugar was never equipped to deal with high levels of blood sugar. You remember, guys, up until very, very recently, I am a kid. As a kid, I can still remember talk of malnutrition and malnourishment. This was never a thing when I was a kid. And I'm not that old. And so this was never a thing. So for the major part of our evolution, we never accustomed to having high blood sugars sitting in our blood vessels. And so it was never equipped to deal with high levels of blood sugar consistently. So as a result of that, we develop blood vessel, and I'm going to just for dramatic effect, guys, just to drive the point home, we develop blood vessel inflammation. This is what underpins the action of diabetes. Now, if you remember that time when I had hair and a heart full of dreams? What were the problems or the disease that people were coming into the hospital with? Stroke, bleeding in the eye, behind the eye, heart attack, kidney failure. Now remember, our kidneys filter our blood, right? And so our kidneys have a very, very rich, very, very complex blood supply. And because of that immense blood supply, our kidneys are especially susceptible to blood vessel inflammation. And as anybody could imagine, a filter has to have very, very small blood vessels. And so those tiny blood vessels, they don't have much tolerances when they become inflamed. So that's why a lot of diabetics they have kidney failure as a result of that. And then we all know the diabetic foot. Now, diabetic foot happens when there is, there's poor blood supply to the foot, and as a result of that, and it also kills the nerve as well. And so there's a small cut now. It is probably not picked up on, and that small cut festers. And because there is poor blood supply to the foot, there is no way that you can get white blood cells coming to deal with the infection. There is no way that you could have rich blood coming to the area to bleed out whatever the infection there. You can't transport the necessary building blocks to repair the cut because there is no blood supply. And as a result of that, the wound festers, unfortunately. And it's very, very difficult to heal. That's why diabetics tend to have very poor wound healing, because especially in their feet and their arms, because there's the long blood vessels. And as a result of that, they can't get the building blocks, they can't get the white blood cells to help with the infection, and so the wound grows and grows and grows, unfortunately. If you notice, if there's a really poorly controlled diabetic, have a look at their feet, and you will notice that from their ankles thereabouts, it gets darker. And that dark ankles is as a result of blood pooling there, not circulating well, and you get staining, where because that blood is pooling, you get your red blood cells dying, releasing iron, and that iron stains the foot dark. Next time there's a poorly controlled diabetic, look at their ankles, and you may very well pick it up. That person most certainly has blood vessel disease. So, for anyone who didn't know before, this is the site of action of diabetes. And this here is the outcome of that. So, it's a serious thing, guys. And it's something that has dire consequences. This is not no cough and cold and, a little bunk store and stuff. This is serious stuff. These are heavy things. This can put people in bed. This can risk their lives, all these things. And so, the question now is, well, okay, how do I deal with my insulin resistance? How do I reverse my blood vessel inflammation? And it goes back to what I said before. We must change our lifestyle. Now, if somebody has been diabetic for a very long time, actually, let me rephrase that. Any diabetic or anyone looking to change their lifestyle in any significant way, I would strongly advise you to consult with your physician first, because they will be able to guide you in the lifestyle changes that you're looking to do, to be able to achieve your goals in a sustainable way. My style of medicine is not one where we go hard and fast and we look to do magic and make big changes all at once. 100% of the time, guys, those people, they always relapse, and we bust and we fail. For me, I like to take a slow, steady, methodical approach, and that way we give the body a chance to be able to acclimatize to the change, get accustomed to the change. And before you know it, we're in a different place altogether. Because again, diabetes didn't develop over a couple of days. It was months and months and years of living a certain way. And mentally as well, of course, Because remember this. Remember the action of insulin is to push sugar from the blood vessels into the cells. And because insulin no longer really works, the cells don't see the sugar. It just sits in the blood vessels. So your cells yearn for the sugar. They signal the brain, hey, we need some sugar. And that's why a lot of diabetics crave sugar as a result of that. And so we have to these changes to be made, is not just a physical one, it's a psychological one as well. We take our time and slowly we get there. So for instance, rather than taking the muffin at 10 a.m., rather than taking this muffin here, hey, let's not take the muffin. We just had breakfast. And so as a result of that, very happily, we have now come away. We've removed this entire insulin spike altogether. And what we'd have done now is we would have allowed our blood sugar to normalize itself. Until lunch, for instance. And then you know what? Something as simple as that little 4 p.m. snack for the road, we could do without that as well, right? And so we take away this sugar spike and insulin spike as well. And what happens now is that we allow our blood sugar to normalize. And our graph now looks a little better, right? Don't you think? And so that way, we have 2 less spikes. So our average blood sugar drops. And to be honest, we could just remove one over the course of 2 weeks a month. So for that 1 month, the only change I'm making, I'm telling Mr. Muffin Man, yo, thanks, but no thanks. For 1 month. And let me get accustomed to just not having any food around that time. And then when I'm comfortable with that now, you know what, that convenience store guy, that Mr. Parlor guy, as much as, he needs my money to help the economy going, let me keep the money in my pocket. let me not buy the cookies and the juice and the soft drink for the road. And so, you know what, my wife makes some food for dinner, I'll wait till dinner. And slowly over time, you do that for a month as well. So now over 2 months now, you've removed 2 spikes. And this is very, very real difference. This makes a very real difference. And what you can do is, because you have a 3-month window for your HbA1c, you start a HbA1c, you take one before, then you run this for 2 months, even 3 months, see how it goes, and you repeat your HbA1c again. And I promise you guys that there's a overwhelming chance that the HbA1c will drop, right? It will drop. And in doing that now, you're encouraged. Hey, I'm making some progress. Things that my blood sugar control is getting better. Now, of course, I said it before and I'll say it again, especially if you're diabetic, any changes to your lifestyle and your diet, please consult with your physician first, especially if you're taking diabetic medications that has the possibility of dropping your blood sugar. Because the last thing I want is somebody trying to do this without the guidance of a physician, and they go with their blood sugar low and they could end up in trouble like that. So please consult your physician before you try any changes at all, because he'll be able to tell you and to guide you exactly how to do it. And slowly over time, as we're now accustomed eating just 3 meals a day, we could even push it even more, guys. And you know what? As much as I had lunch, after 7 o'clock, it's really just to go and sleep. So you know something? I'll just drink a cup of tea. So what we do now is, that cup of tea has no milk, no sugar in it. Maybe it's chamomile, maybe it's tulsi, maybe it's some bush tea or herb tea. And we go now till the morning again, right? We have even less insulin bubbling in our blood. And as a result of that, our insulin resistance gets better and better. And again, this could be done over the course of a month or 2 months, right? Rather than having a cup of Milo and 5 Cricks, let's have a herbal tea and the 5 Cricks for 2 weeks or 3 weeks. And then, okay, I'm cool with the herbal tea and the 5 Cricks. Now let me go 4 Cricks for a week, 3 Cricks for a week. And that's how we go. Slow, steady, methodical. And then after we do that now, well, you know what? The Doubles man and me, we're good friends, right? He has a good product and I wish him all the best, but you know what? Let me keep my money in my pocket. What I'll do instead is, maybe I'll have some oats, maybe I'll have some eggs. And as a result of that now, our blood sugar looks like this instead. So now we're removing spikes totally, but then when we do eat, our spikes now become less and less, more manageable. And as a result of that, guys, we become less insulin resistant, and then the insulin is free to now direct the blood sugar back into the blood vessels, the blood sugar into the cells to be used as energy. And this is how we redeem ourselves from a lifetime of living a certain way. Slowly, steadily. Of course, we work in conjunction with our physician and whatever diabetic medications we're taking. And you will find that as time goes by, you feel better, you start to feel better. You know, and this, guys, is how we go. So, my hope is that, I know it's a bit of a longer video, and I know we got a little in-depth with the graph and whatnot, and the blood test and whatnot, but it had to be done. Because I know too many people personally and professionally who are afflicted with diabetes, and it's something that happens in our daily life without us thinking about it. And before you know it, sometimes you go for a blood test, a little annual physical, and you get a diagnosis. And you know, it really does throw people for a loop. So my hope is after today's lecture, you understand exactly what insulin does. You understand how someone gets diabetes. You understand how you can monitor it. And you understand where it has its effect. And you understand exactly what can be done to help with it. So, hope is, guys, you understood that. Any questions, you could always leave a comment, leave a like, and I'll catch you guys in the next classroom. All the best.